Hello, and thank you for contacting Wave Support. I see from your clinical request you're struggling with this post-refractive surgery patient with comfort on this lens. And I'll be honest with you, these are some of the most challenging patients you're going to run across. If you've had a lot of experience with these, it seems like the rules go out the window and everything looks great and they still aren't happy. And I've got a handful of these patients in my practice that it seems like they're kind of lifers here. They're always coming back for, oh, they aren't quite as comfortable, but they see great and the fit looks good. So they can be a bit challenging, but if you stay with it, I think hopefully you'll find a happy median. Just a couple of general observations. With a lot of these patients, sometimes we overlook the obvious underlying physiology going on with the eye. Don't forget to make sure you haven't overlooked any meibomianitis issues, tear film issues that could preclude the patient from wearing a lens anyways. Assuming those things are all okay, when I look at these designs, there's basically a few options with it, and obviously you've been working a little bit more with sort of what I call a semi-scleral design, sort of that small scleral lens. It's a nice concept, but what I find more often than not with these post-refractive surgery patients, it seems like I try large diameter lenses, scleral lenses, semi-scleral lenses, and more often than not I end up with a large on-corneal design. And I think more often than not I ultimately end up with a corneal lens of some kind. And we'll talk more about that in a moment. A couple options with a lot of the Wave docs are using the Wave OCT fitting set. That's that large diameter 16 millimeter, 15 to 60 millimeter lens set. I don't know if you've had any experience with that yet, but it's a neat system. I don't do a whole lot with those, but I know Dr. Jim Edwards does a lot with that, and that could be an option for you. If you have the system, that could be another thing to try. With that said, if we look back over here, it sounds like you've exhausted a lot of options with the 12 to 13 millimeter lens. I'd probably look back at putting it more of an on-corneal design. A couple thoughts with that. If you recall, I noticed most of your designs are axial. If you remember, axial tends to represent the central cornea pretty well, but doesn't always give you as close representation as peripheral cornea. So what I tend to notice with a lot of these patients, if I'm having comfort issues, lens awareness issues, it seems like if I switch over tangential design, I get a little bit of a flatter design, and it seems like it just creates a little bit nicer corneal lens relationship out here in this peripheral cornea. So it seems like I get a little less awareness issues when I go that route. And of course, every patient's a little different, so I wouldn't hang my hat on that, but when in doubt, I tend to lean in that direction. So I kind of mocked up a lens here for I went to about 11.5 millimeter. Again, with these patients, what you're going to find is, as you know, with a lot of rigid lens, whereas the less movement you have, the better, because you tend to get less awareness that way. So that, of course, is sort of the impetus for these scleral lenses. But if you go with a large enough corneal lens, you can get very minimal movement, and you get a pretty comfortable lens on that eye. So what I would probably do is I would consider going to a large diameter. I went to about 11.5 to sort of start. Placement of those peripheral zones, I see exactly what you did. I would have done the exact same thing, trying to get the red dot somewhere here along the interior margin of this steep zone, and then set the other anchor point out here. And I try that, it makes total intuitive sense, but for some reason it doesn't work all the time. So I found more often than not I sort of bridge the gap there, take about half the distance or so. In this case I set around 5.5 or so. And then I usually go a couple of millimeters outside that. This one I set at about 7.5. And then I set the tangential and went freeform tangential and just went ahead and let the lens design. And what I end up with a lens that, at least on paper, looks like a pretty nice representation here. Now some docs like to put a little back surface, a spheric design to that. If you look at this, you've got a little some abrupt changes there in the posterior curves. Some docs, if they put a little back surface, a spheric design, just you'll see it kind of softens up those curves a little bit. So some docs like to do that. I try to keep it simple on some of these. I just try to at least start off with a more of a spherical design, tangential, and then trying to get a nice even landing zone out here. If you can do that and get it pretty even around the outside of the lens here, then you're going to more evenly distribute this weight of this lens out here in this zone, and hopefully that'll get you less movement and maybe a little bit better comfort. Don't forget to get enough edge clearance here, and hopefully it'll give you a little bit better fit. Of course, these lenses all look great here. Every patient's a little different, and again, I can't emphasize how much these are all challenges, every one of these patients. But I would probably try that since it sounds like you've spent a lot of time, effort, and resources on the little larger diameter. I'd probably go maybe work a little bit more on a corneal design and try not to get too frustrated. They're very challenging. And if you haven't looked at that OCT set, that's also another option for you, the large diameter, about a 16 millimeter lens. And you can always contact Wave to find more information about that system if you don't already have it. So with that, I wish you well. Thank you for contacting Wave Support. Don't get frustrated. I've got a couple of these lifers in my practice that have been coming back regularly for 2-3 years at a time, and it can be very challenging, but hang in there. I wish you well. Have a great day. Thanks for contacting Wave.